Drugs related to cholinergic system. Location of receptors to correlate the basis of application of the drugs. Though these receptors are present in many organs, they are predominantly present in the following: M1 brain, M2 heart, M3 eye, bladder, etc., NN neurons, NM muscles. First, drugs acting on muscarinic receptors, the agonists. Drugs that act on all subtypes of the receptors. First, pilocarpine. Second, arecolin. Third, tertiary amines, since they are lipid soluble and can cross the blood-brain barrier. First, in tertiary amines, physostigmine, donepezil, rivastigmine, galantamine. Organophosphates, since they are also lipid soluble and can cross the blood-brain barrier except icothiopate. Under organophosphates, first diflose DFP, second malathion, third diazinon, fourth tabun, fifth serine, sixth soman. Tabun, serine and soman are used in chemical warfare. Next type of agonists are those that act on M1 receptors. First, MCN 343A. Second, oxotremorine. Next, those that act on M2 receptors. First, methacholine. Next, those that act on M3 receptors. Bethanechol. Overview. Next, drugs acting on muscarinic receptors, the antagonists. First, drugs that act on all subtypes of the receptors: atropine, hyoscine, or also known as scopolamine, quaternary compounds, first atropine methonitrate, second homatropine, third hyoscine butyl bromide, fourth ipratropium, fifth thiotropium bromide, sixth propanthelin, seventh oxyphenonium, eighth clidinium, ninth simetropium bromide, 10th isopropamide, 11th glycopyrrolate. Also, anti-Parkinsonian drugs. First, trihexyphenidyl, also known as benzhexol. Second, procyclidine. Third, piperidine. Next, drugs acting on the M1 type of receptors: pirenzepine, tilenzepine, dicyclomine. Next, drugs acting on the M2 type of receptors: metoctramine, triptramine. Next, drugs acting on the M3 subtype of receptors, those that are vasoselective. First, oxybutynin, second, flavoxate, third, tolterodine, fourth, darifenacin, and solifenacin. Also, the Midriatics. First, cyclopentolate, second, tropicamide. Overview. Next, drugs acting on the nicotinic receptors, the agonists. Those acting on all the subtypes: nicotine, lobelin, tetramethylammonium, varenicline. Next, those acting on the NN type of receptor, PTMA, which is phenyl trimethylammonium. Also, tertiary amines like edrophonium, neostigmine, pyridostigmine. Also, the organophosphate, icothiopate. Next, drugs acting on the NM type of receptor, DMPP, dimethylphenylpiperazinium. Overview. Next, the antagonists of nicotinic receptors, NN type. First, tubocurarine and alpha bungarotoxin. Next, NM type of receptor, hexamethonium and trimethophan. Overview.